Hello and welcome to this learning review session where we would like to share with you the findings and the learning from an initial case review carried out by Aberdeen City Significant Case Review Subcommittee. My name is Fiona Miele and I'm the Lead Nurse for Child Protection for NHS Grampian and Chair of the Aberdeen City SCR Subcommittee.
And I'm Kim Fraser. I'm one of the service managers with Integrated Children and Family Services, and I'm a member of the SCR subcommittee. By way of introduction to this learning, we received a notification for the initial case review in relation to Family G in autumn 2019. The family's name or initial has been changed for anonymity. The notification is progressed by the Significant Case Review Subcommittee, who do this on behalf of Aberdeen City's Child Protection Committee. All agencies in the Aberdeen City Partnership submitted a report on their involvement with the family, and that included Children's Social Work, NHS Grampian, Police Scotland, Education Services, SCRA and the Third Sector, which comprised Bernardo's, Befriend a Child and Families Outside. The Significant Case Review Subcommittee considered all those submissions, and in the next few minutes we will outline what we learned from this case review. We can use this learning to improve our practice across the city. The case was referred to the SCR Subcommittee by NHS Grampian in response to their concerns that a family of 4 children aged 14, 9, 7 and 6 years old at the time of the case review had suffered the impact of cumulative neglect over many years. This was a family that was well known to all agencies: NHS Grampian, Police, Education, Children's Social Work, Housing, the Third Sector and SCRA. Between them, agencies were aware of the issues impacting on this family. The parents of the children were both involved in drug misuse, and the father had served several frequent prison sentences for drug crimes, domestic abuse and violence. As a result of the domestic abuse between the couple, the mother had sought support from Women's Aid at times. There were mental health issues for both parents, including depression, anger management, undiagnosed ADHD and a possible personality disorder. The children's attendance at school was particularly poor and they were often late. Family moves meant that several schools in the city had been attended. At the time of this ICR, the eldest child, who had just turned 14, had attended 4 primary and 1 secondary school in the city. And that child also took on a carer role for his siblings and was taking them to school himself. He was also taking responsibility for organising food for the family. The children's names had previously been on the Child Protection Register for 7 months, way back in 2013 into 2014, and they'd also been subject to compulsory supervision orders in 2014 into 2015, and the grounds at that time related to parental drug misuse and domestic violence. Another referral was made to SCRA in 2016, but there were no further formal measures until the children returned to the Child Protection Register in August 2019, closely followed by compulsory supervision orders. Throughout, though, there had been considerable professional input over many, many years from a range of services. This family experienced the revolving door of agency input over the years. Since 2013, the family had been involved with over 20 different multi-agency services, which I'm going to list to you now to give you a sense of the extent of that involvement. Grampian Women's Aid, Home Start, Community Childminder Service, Family and Community Support Service, the Nature Nurture Group, Outdoor Explorers, Befriend a Child and Play Scheme, Criminal Justice Social Work, an early intervention worker from the Timmermarket Clinic, Caledonian Project for Dad, Caledonian Support Worker for Mum, clinical practitioner from Children's Social Work for parents as a couple and also offered separately to mum, Families Outside, Priority Families, Homeschool Liaison Officer, Family Learning Worker from Education, Food for Fun, Bernardo's Worker, Intensive Family Intervention Team, Weekend Service, a play therapist from education, and a criminal justice support worker for Dad. Education, social work and health records show considerable and repeated input into the family to provide the parents with strategies to implement more effective parenting, to establish routines within the home, to promote a clean, healthy, nurturing home environment for the children, and to enable them to attend school regularly. Supports were persistently offered in order to mitigate harm. Having read through all those submissions, a number of learning themes were identified by the SCR subcommittee, and we'll now start to take you through those.
The first theme that emerged was that it was clear that despite the input that this family received, they continued to live in an environment that was neglectful. So cumulative neglect was a major feature. The neglect was physical, environmental, emotional and educational. A home visit found that the children did not have their own beds, sharing with each other and their mother. There was insufficient bedding, there was urine-soaked mattresses, there was no lighting, there was broken electrical sockets and fleas and maggots were present within the home. The children had poor attendance rates for school, and when they did attend, they were often very late. They had poor dental health. They had a poor diet and often had to feed themselves. Their health needs were not met and they were not brought for medical appointments. The eldest of the children had taken on the role of the carer for his siblings and was taking them to school himself. He was also taking responsibility for organising food for the family. Previous learning reviews have identified the theme of cumulative neglect and there has been significant multi-agency drive to raise awareness of the impact of cumulative neglect. There is strong evidence to demonstrate that this has had a positive impact, but this case also illustrates that this requires to be an ongoing. This case demonstrates the need for all agencies to consider neglect as a potential criminal offence or the need for other legal proceedings. It re-emphasises the critical need for all practitioners to accurately record information relating to the physical, emotional, educational and medical, and that's including dental, circumstances of neglect, to enable a court or children's hearing to take effective action to safeguard the children. While there was extensive professional activity, the impact of this failed to make any sustained impact on the lived experience of these children. There was a perceived lack of clarity as to best practice for tackling neglect. So what actions have we already taken to address the issue of cumulative neglect in Aberdeen City? We have multi-agency training delivered by the Learning and Development Subcommittee throughout 2019 and 2020. We've held a series of neglect conferences held in Aberdeen City at the end of 2018 and into 2019 by the Child Protection Partnership and by Aberdeen City Child Protection Committee. We have produced a 7-minute briefing on neglect for multi-agency learning. There's continued learning from national and local significant case reviews and initial case reviews that has been rolled out to incorporate within our own learning and development programme. So what can you do now? We're asking you to attend the refreshed learning and development training from our programme. We're asking that we are aware of the insidious nature of cumulative neglect. We're asking you to speak to your colleagues in your service and those of other services if you are concerned. We're asking that you do not allow yourself to get used to this and to record it and act on it.
The second learning theme that emerged when we were looking at the submissions from the ICR was in relation to multi-agency communication. Now, this is a recurring theme both in local and other national case reviews, either initial case reviews or significant case reviews. What we found in this case specifically was that there were vulnerabilities at named person to named person handover points. That would be from the health visitor into nursery, from nursery into primary school, from one primary school to another primary school, and then on to secondary school. We found that there was a need for agencies to communicate clearly with factual information and analysis when they were referring to other agencies, in particular SCRA and the Children's Social Work Service. There were a number of agencies and services involved with this family, as I've already illustrated in that great big long list, and that may have given a false reassurance to SCRA and to others that the family were engaged with services and getting the support they required, and thus there was no requirement for legal processes. However, the effectiveness of service input was not apparently known or considered. What we saw was that third sector agencies who were quite heavily involved with this family were not always included in child planning meetings, and they were not always aware of the changing or the holistic needs of the children and the family. The child's plan was not routinely shared with third sector partners, even when this was requested. The SCR subcommittee were also a wee bit concerned that given the volume of professional activity, about the level of clarity that the children and their parents had of what agencies were trying to achieve through those interventions. We found that IRD processes weren't followed in this case, and not all agencies were represented at the IRD. The sharing of information between adult and children's social work services was not as effective as it should have been in relation to parental issues impacting on the children at home, in particular the domestic violence and criminal justice elements. Education, social work and health records all feature repeated input in respect of providing parents with strategies towards more effective parenting. A lot of support was offered in order to mitigate harm, but the patterns, the parental non-engagement and the lack of any sustained improvement was not picked up over a long time. We found that agencies too often worked in silos and took too long to pick up on the cumulative nature of the neglect. So what have we been doing in order to address this issue of multi-agency communication? Education and health transition policy is being reviewed, and this will ensure that there's an earlier sharing of information about children with additional health plan indicators to ensure effective planning for entry into primary school. There's a plan for supplementary training for the reporter to consider the effectiveness of service interventions to inform decision making, rather than being reassured that information that services are involved is sufficient in itself. We have updated and we have introduced quality assurance around our IRD process across Aberdeen City. And we have introduced a quality assurance framework that includes an auditing of child's plans. And what can you do now? We're asking that you think communication with your colleagues and with your partners. What do you know? What is its relevance? And this is where you know best. What requires to be shared and what patterns can you see? We're asking you to think about quality, not quantity. This case illustrated more than any other that more services are not necessarily better. Make sure that the expected outcomes are clearly understood by you, by your colleagues, and by the family themselves.
The next theme we identified was that of assessment, analysis, and planning. And again, this theme has been identified previously with ICRs that have been carried out by Aberdeen City Subcommittee, and there are actions within the Child Protection Improvement Plan to support continuous improvement across the multi-agency workforce. In this case, many agencies worked really hard with this family, but there was a lack of focus on this in a coordinated way, and there was evidence of silo working. There was a lack of effective use of chronologies to reflect on patterns and themes emerging from this family that would have identified the risks, specifically around domestic abuse, father's criminality and his prison sentences, parental drug misuse, parental mental health issues, and the impact of poverty on this family. The use of the National Risk Assessment Framework would have identified the risk and the need for these children with analysis about the impact of neglect. A comprehensive parenting assessment was never undertaken to identify the need around the quality of parenting the children received. This would have provided clarity on the outcomes that need to be need to be there for improvements for these children. There was evidence to indicate that agencies were working in the here and now rather than reviewing the recurring patterns and chronic nature of the case. This meant the family experienced the revolving door nature of service input, with frequent changes of practitioners working with the family. And this makes a relational approach really difficult to establish. The effectiveness of the interventions that were being delivered to the family did not appear to be systematically considered. There was a persistent cycle of improvement and deterioration. The children were adversely affected by their parents' behaviour around drug misuse, domestic abuse, parental mental health issues and criminality, including that of drug offences and crimes of violence. Records highlight a clear pattern of parental non-engagement. More than one agency did identify a concern that professionals who are repeatedly exposed to neglectful circumstances may become desensitised to the impact of neglect on children. Similarly, the emphasis on supporting children to be cared for within their family cannot be at the expense of their safety and well-being. So again, what actions have we already taken to address this issue of assessment, analysis and planning in Aberdeen City? There's refreshed multi-agency chronology training. We have updated the multi-agency training on assessment and analysis. And NHS Grampian has prioritised this and has a rollout of training for all health visitors, family nurses, school nurses and midwives on assessment, analysis and planning. So what can you do? We're asking that you attend the refreshed multi-agency learning and development training on this topic. We're asking that you use regularly the NRAF tools and use that routinely and share with colleagues in your service and in your partnership. It's around making sure that we're studying our chronologies, we're using them to identify patterns and themes. We need to be mindful of the rule of optimism, look out for that and be alert to non-engagement. And we must allow ourselves not to become desensitised to the impact of cumulative neglect. So we need to keep challenging ourselves.
The fourth theme that emerged from our consideration of the submissions made across the partnership was in relation to professional challenge and curiosity. This case demonstrated to us that practitioners need to be supported to make professional challenge where there is a discrepancy about how a case is viewed. Now, this case was characterised, as you'll have gathered, by cycles of improvement and deterioration. At times, agencies sought to involve others, but they were often thwarted by a period of perceived improvement. And this is particularly true of referrals made to children's social work and to SCRA. Decisions were not, however, challenged by reference to the emerging patterns of parental behaviour or the professional knowledge of the impact of those behaviours. Now, a previous case review in Aberdeen City had already identified this issue, and a clear message was given within the sharing of that learning that there is an expectation from practitioners to respectfully challenge decisions that are made about children and young people where there is not a shared view. And we would reiterate that again here today. We support a culture across our partnership where open dialogue, professional curiosity and respectful challenge is the norm and is valued. So actions already taken to address this issue include a protocol having been implemented between SCRA and the local authority that requires reporters to communicate clearly the reasons for decisions that differ from the local authority recommendation. And that also enables an escalation of concerns about referral decision making. Also, the Child Protection Committee is working on a formal protocol to enable respectful, evidence-based professional challenge across partners. And what can you do in the meantime? If it doesn't feel right, we're asking you to say so, but to do so and explain why by reference to your professional knowledge and to evidence your position. You can do this directly with your colleague across the partnership or through your line manager. And if you are one of those line managers, to support your staff to do this. At all times, any such professional challenge must be respectful and courteous.
This learning review did identify many aspects of good practice, and it's really important that we share that with you. What we found was that once the threshold for child protection intervention had been reached, there was an appropriate multi-agency response that led to a child protection case conference and registration on the Child Protection Register for all 4 children. There was prompt response from the reporter following the IRD, and a children's hearing was convened, and compulsory supervision orders were gained for all 4 children. The children all had comprehensive medical assessments following the IRD that was enabled us to identify their medical needs. There was a prompt response from social work following the IRD to address the living conditions of the family, and resources were identified to improve the conditions significantly.
After the SCR subcommittee had considered all the submissions, what happened was that they agreed that the children in Family G had suffered from significant harm, and there was concern about agencies' involvement in the case. However, we unanimously agreed that conducting a full-blown significant case review would not provide any additional learning in this case, as it was so closely reflective of previous case reviews carried out locally over the last year or so. So the SCR subcommittee recommended, and both the Child Protection Committee and the Chief Officer Group agreed not to proceed to a significant case review, but with an expectation that this learning be rolled out across the partnership. And as we have highlighted already, the 4 themes of that learning are in relation to cumulative neglect, assessment and planning, multi-agency communication, and professional challenge and curiosity. We conducted a learning session for practitioners involved with the case to enable them to explore the learning that we felt had emerged from the case review. This model has been used previously in Aberdeen City, and we've found that practitioners welcome the opportunity to hear the findings of the review, have the opportunity to share their experience of the case, and to give context and meaning to the learning. They were taken through the findings of the ICR, and they agreed with the learning points that had been identified.
So this briefing forms part of the rollout of the learning from the case, and we have posed challenges for you and for your teams today. The learning will be further disseminated through the Multi-Agency Learning and Development Programme, and course has been adjusted to reflect these findings. We will be quality assuring our progress in identifying and responding to neglect in an audit to be undertaken early next year. The report about this will be shared with the CPC and the Chief Officer Group. This will enable us to evaluate the impact of the learning in respect of cumulative neglect and whether any additional learning is required. We will continue to develop our thinking around multi-agency chronologies and supervision, particularly whether this can be developed as a digital tool. We are also developing a mechanism to invoke an objective multi-agency review where sustained improvement is not evident in long-standing cases characterised by a cycle of improvement and deterioration. And we intend to extend the multi-agency protocol in relation to professional challenge across all agencies. On behalf of Aberdeen City Child Protection Committee, I would like to thank you for joining us today. Thank you.